This is Perspectivas Latinas, a community service of CAN TV. I'm your host, Juan Carlos Hernandez. Since 1990, Calor has been helping Latinos and others with HIV or AIDS to talk about their problems with those diseases or conditions. Here to talk about the work of Calor, we have Kathryn Mercado. Welcome.
Thank you.
Great. Obviously, that's not the only focus of the organization, so let's start off by talking about you and what you do with Calor.
Oh, sure. Well, my title with Calor is the Assistant Manager of Prevention Services. So we focus heavily at our agency of prevention in general, so prevention of disabilities. My specific work is I work with youth from the age of 18 to 29 who are young men who identify as either gay or bi men, and we work with these young men and we offer them like support groups once a week, and we do larger events and smaller events and workshops, educational workshops that are mainly themed to empower them as young men, and also to empower their sexuality, and has a large underline of HIV prevention. So we make sure that they feel empowered to get tested regularly and to feel confident about anything that is related to their sexuality.
Okay, sounds great. So Calor has been around for quite a while now. Tell me what you know about the history of the organization, and now it's part of Annixter Center, right?
Yeah. Well, I know that when Calor first started, it was a grassroots effort that started with the need in the community to have support groups around the time when, like early 1992, when there was a big epidemic, or the epidemic of HIV had been heard, and there hadn't been a lot of sort of support from the community, or the communities didn't know how to react to it.
Right.
Because of the need, there was a support group developed, and from there they started to see that there was a greater need in the community for things like case management for those individuals who are HIV positive and needed help navigating the system. And you know, Calor did a really good job with establishing themselves in the community early on. And when around the time they merged with Annixter, it was also they merged as a way to address the community's need to have a housing facility. So their initial project together was to create a housing facility that we actually still have. It's a 17-unit housing facility.
Right. What's the name of it?
Casa Contreras, and it's on Division in California. It's on California, just south of Division, and it has been a part of ours since the merger, and it's a 17-unit facility that is for people who are living with or affected directly by HIV.
Okay.
And I believe that we have a waiting list. So since the time we've had it, it's been a completely occupied. Yeah.
Now, you said they have to be dealing or living with HIV to get in?
So the way that it supports supports people who are living with HIV is that it also provides housing for their families. So
for their families as well?
Yeah, for their families as well. Wow. So and that's some of the things that we bring to the actual unit itself. So if there's ever opportunity to support their families or like the younger children who are in the facility, we make sure that it's a community effort, and that anything that is possible to help them, aside from just providing them the housing, we can offer any other additional support for them or their families.
Okay, so this housing, is it free, subsidized, or
it's subsidized housing? Okay. So it works with HAAS. So they have a grant with HAAS, and so it's.
What is HAAS, please?
I'm not really sure what the acronym stands for.
Okay, that's fine. That's fine.
So I know that it's a housing facility for them.
And you said 17 units. 17
units.
And these units are all the same, or?
No, they're different units. There's a 1-bedroom and 2-bedroom apartment buildings or apartments in the unit. So I think it's split up so that there is like 50-50. So 50% is 2 bedrooms and 50% is 1 bedrooms.
Now, one thing you mentioned, and I think it's from what I'm hearing from you, is that Calor supports this building of community.
Definitely.
And in this housing, how does that work?
Well, I mean, all of our clients are definitely like brought together for certain things in the housing facility. So like they have They have meetings once a month as like a building unit. They make sure that safety is at the forefront, since it's 17 units, a lot of different people, occupants.
Right.
So that's always an important thing. They have community space, a community space and a community garden where they garden outside, and that's something that they actually take really good pride in, and they do every summer. So they have a bunch of different events like that, and also any other way we can complement them with the services we provide at our actual agency. So we have provide different services that could complement them as well.
Okay. So tell me, let's say I'm a person that might be near you or not that close to you, and I think I might, I would like to get tested or find out more information about HIV and AIDS or other services you provide. I go in and they process me, I fill out forms, or how does that work? Because a lot of organizations have a different intake process, right?
Yeah. Well, I mean, from the moment you step into Calor, someone would greet you right at the window, and we offer confidential testing, rapid HIV confidential testing.
What is rapid HIV?
Rapid means that you're going to be able to get your results at the agency when you get there. So your results will be ready in 20 minutes. Yeah.
20 minutes?
Yep.
Wow. And that happens right away if you want to get tested.
Yeah,
okay.
And as far as the information we collect, it's very limited. It's not very invasive. Just very basic information about like your age, how do you identify sexually,
what do you
gender.
mean by that? What do you mean by identify?
So if you identify as gay, straight, or heterosexual, bi, transgender, any way that you identify sexually.
Okay.
We just take that into consideration, just because the counseling session that you might have with your counselor at the agency might be a little bit different, and it's going to be tailored for you.
Okay.
Yeah.
And then what happens?
So we just, it's a very quick consent form, and the kind of information we get from you in the testing room is basically what I mentioned before: age, ethnicity, how you identify. And we go through some risk assessments to just make sure that if you just ask, I mean, some of the questions could be personal,
right.
But it's
and
just,
they have to be
so that we can identify any sort of like risk reduction plans that we should go and tailor specifically for our clients.
Right.
But the whole process altogether is about 20 minutes of counseling, 20 minutes for the test to develop. And from there, there's 2 ways to go about it. So depending on the results, you could be at our actual agency for 40 minutes if it's negative or a negative result, or if it's a preliminary positive, that's a different type of a situation as well. It could seem scary for most people, but it's that we try our hardest to make it not scary by doing as much as we can to help them navigate the system. So what I mean by that would be from the moment that you get a preliminary positive, when the reason why I say preliminary is because in order to say that this is for sure a positive HIV test, what we do is that we take a second test called the Western blot, and we send it to a laboratory. So there's not, without a shadow of a doubt, in either of our minds, that the results you got today or the results you'll be getting are actually accurate.
And how long do those results take to come back?
Just a few days.
Just a few days?
Yeah, just a few days. And then from there, we're able to help our clients navigate the system from finding a doctor right away and making sure that we link them to care. So we would, as far as schedule a doctor's appointment, ask them if they wanted one of us, or even their actual counselor who tested them, to accompany them to the doctor's appointment, because we find, and I think that the national HIV strategy in general finds, that most of the newly diagnosed positives fall within what they call a continuum of care. So it means from the moment they got tested to the moment they actually access services, whether it's at a doctor's office or getting medication, that there seems to be some sort of falling around that time from one step to the next.
People just decide not to continue, or they get scared, perhaps?
Yeah, I think that you're right. It has a lot to do with fear, uncertainty, not really knowing what the next steps are. And in a lot of cases, I think for the Latino community, just lack of understanding the process. So some people who might not have health insurance might feel as though that they don't have any sort of anywhere to go, or any sort of like income to support something like making sure you're getting your treatment if you're HIV positive, which is not the case at all. Anyone who is HIV positive is allowed and is encouraged to navigate the system and make sure that they get their medications to help keep them healthy and make sure that they are able to live a really healthy lifestyle for as long as possible. So that's probably one of the major misconceptions.
Okay, and that even if they don't have insurance?
Even if they don't have insurance, yeah.
Really? I'm curious also because a big part of the Latino community are also undocumented folks. They would also be eligible to receive this?
Yeah, and I think it's really important for people in the Latino community who are undocumented to know that, you know, there are sometimes, like, for example, when you're actually taking the HIV test, where we might ask some personal information like, do you have your social security number? And even though this is a question that we ask, it's not mandatory. So, you know, so disclosing that either you don't have one or that you don't wish to share one is completely up to our clients. And from there, there are different types of referrals that we would make to other organizations, for example, Core Center being one. That would allow them to get services right away with or without documentation and with or without health insurance.
Okay, and you're telling me, and it is, as far as health, the biggest part about how to do follow-up and continuing to get the care that they need. How do you help individuals who are now have to face these diseases? How do you help them navigate the personal side of this, talking to family? Do you help with that?
Yeah, definitely. I mean, one of the main things we do in our counseling session, which is the first time you get tested, regardless of whether we know your status or not, at the point when we test you, we ask you what it would be like if you got a result today that you weren't prepared for, just so that we as counselors can really test the waters and know where you're coming from as a client. And from there, we develop a plan, whether it's how are you going to tell these individuals in your family that are closest to you, if you want to or not, because it's disclosure is completely up to a client.
Right, right.
And I think the most important is if they feel supported to go and get treatment right away, because you know, it's just been proven that clients who are HIV positive who get into treatment right away have the healthiest outcome in life. So the longer you wait or the longer you walk around and not get tested because of fear or not uncertainty of what the process looks like, the more danger and risk you're actually doing to your health.
Right, and as you're saying now, as you just said, HIV and AIDS is not necessarily for many people a death sentence, right?
Oh, absolutely not, especially where technology is nowadays. You know, I know that it's had such a long history before there was any even medications to develop to, you know, treat some of the symptoms that were associated with being HIV positive or having, you know, an AIDS diagnosis. So the medications have by far have developed so much in time that it makes it really easy to live a healthy lifestyle. And the whole point of the medications are turning nowadays is for the client. You know, when HIV started, they used to say that, you know, they would have like cocktails or, you know, and it would be like a regimen of 6 or 10 pills to take throughout an entire day, which, I mean, not only would have tons of side effects, which our people aren't experiencing these days, but it would just be so much time out of your day to maintain that it was really hard for someone who wanted to live healthy and to get treatment to maintain that type of lifestyle. So the technology nowadays and the way medication is nowadays is completely improved. Just so that it's like almost 1 to 2 pills a day, specifically depending on like what your doctor recommends. But I'd say the majority of it is a lot more user friendly and a lot less side effects than what we first experienced when the epidemic first arrived.
Right, because I saw the film Dallas Buyers Club, and I was wondering why, because I saw, I don't know if you saw that film.
Yeah, I did.
And just like you said, this cocktail of drugs and other things that the characters in that movie were taking just to stay healthy, that no longer, what you're saying is that it's no longer the case.
It's definitely no longer the case, and I think that, I mean, that was a great movie, and it definitely was a great depiction of what our country looked like when the epidemic first happened.
Right, the fear and all of that.
The fear, the stigma. I'd say, you know, although the medication has changed, I'd say one of the major things that haven't changed is the stigma. So it's a great opportunity to be here and to talk about it, because I think that, you know, even with newer generations, I work with youth primarily. I find that not only are they uneducated about it, but the stigma has continued through generations and through advanced advances in science and everything. So talking about it is probably the biggest help to do with it, and educating on what it means to have a risk that's associated with HIV, or if you're having a certain behavior, like what that looks like,
right.
And what's not a risk at all, and what's completely safe to do.
Right. So you work, one of the programs that you work very diligently in is called ACE, right?
Yes.
Tell me what that ACE stands for and what you do through that program,
ACE
please.
stands for Advocating for Community Empowerment, and so we're funded directly through the Center for Disease Control.
Okay.
And what we do with this program is that we work, like I mentioned, with youth who identify as gay or bi from the ages of 18 to 29. And
this is with men?
With men, yeah. And this is in the Chicagoland area or surrounding suburbs. And what we do is we try to implement an intervention called empowerment, and it's structured to empower these youth to feel confident about their sexuality, decisions they make in life, how to deal with stigma, how to deal with discrimination, how to feel confident in having a healthy relationship. And also how to support one another in a community. And so a lot of the work that we do on a group level, we do offer for the youth individual level counseling, but what we do on a group level is really important because it involves their peers. So where you might not grow up in a school that has a lot of guys that look like you, this is an opportunity to not only be around a lot of guys that look like you and believe in the things that you do, or live the same type of lifestyle that you do, but it also allows them to teach each other how to behave appropriately and how to empower each other instead of like maybe what's easier around that age, which could be tearing each other down or nitpicking or being hypercritical of one another.
Right.
It really just promotes the opposite of that.
So how do these groups form? Are they? Is it just one group that comes together just maybe once every season, or is it something
we actually meet once a week, and it's a great question as to how the groups form. I feel really confident about it because we have the way that the intervention is structured is that we have a core group of guys that are the decision-making bodies of it, and so they're pretty much and they are all made up of youth that are from this demographic. So they fall into the demographic, they decide what's going to be talked about, so it's not like a agenda that we bring as an agency to the table. It's completely client focused, and so they decide what the monthly calendar is going to look like. We meet once a week as a leadership committee, and we talk about how we're doing, some ways that events happened and how we can learn to make it better for our clients in the future. So they really do a lot of the planning and a lot of the volunteer work that takes to invite their friends to these groups and invite their friends to the larger parties that we do, and encourage their friends to get tested. And informal outreach is what we call it, those conversations that guys take away from actually coming to these workshops and meeting us and hearing what we educate them on. The informal outreach that happens outside of it is what's the most important.
And what do you educate these young men on? Tell me about that. And then you said the informal outreach that they do, but crucial is the information you're giving out.
Yeah, definitely. We definitely educate them on the risks that are associated with HIV, so ways that you can get HIV, and we educate them on how important it is to get tested. So the Center for Disease Control recommends that youth in this demographic gets tested every 6 months as a part of their regular healthcare routine, and that's regardless of their relationship status. So I think that's a really important thing that we teach them on, what it means to be healthy, which means to get tested regularly, regardless if you're in a relationship or not, regardless if you're being celibate or not, just as a part of a routine. And I think, or what else we teach them about is just how to negotiate safe sex. So whether they're in a relationship, how to say, I want to introduce condoms back into our relationship, or how to negotiate safe sex in a new relationship. So whether they're dating somebody, and how to feel confident, to take that first step and to mention having safe sex.
I guess for a lot of individuals that could be tricky or a challenge, to bring it up.
Oh yeah, I mean, I could say that the atmosphere is one of the bonuses of working with this. The youth that I work with have such a great outlook on life and such a great attitude about things, and no matter what sort of disparities that they're facing. So I think that encouraging them to do role plays and kind of visualize what scenarios like this could look like, you know, whether at the end of it or not we're laughing and it's not as realistic as possible. I know that they feel more confident and they have the resources they need to actually implement it when the time comes.
So they organize the role playing, they organize the conversations, or
that's a part of the structured model. So we have certain types of workshops. One of them is called Below the Belt, and that one we actually have every last Wednesday of the month, starting at 6 p.m. And that's a really good workshop. If I could take a second to talk about it,
sure, go ahead.
It's our most structured educational workshop as part of ACE. And we always invite new guys who are considering to check out what our agency is like or what the ACE program is like to come on those nights. It's a 2.5-hour workshop, and it's structured on everything that I just mentioned about empowering yourselves and in every holistic aspect of your life as a young gay or bi man. And what's really great is that we always provide bus cards as a way to make sure that most of our clients, I'd say the majority of our clients, come via public transportation. So we want to make sure that, you know, we are saying to them that we appreciate the commute to us, and we want to make sure that you can get home safe as well. We also give them a $25 Target gift card and a gift bag full of lots of prevention materials, and so lots of condoms and lubes and everything that they would need to try to practice what we just talked about in their life. And also just to show them, introduce them a space that they may not have ever heard of before, and they know that, you know, that we don't ever want a challenge for having a safe sex life to be that you don't have access to these resources. So we really make sure that we give them what they need, whether it's, you know, support with getting condoms and lubricants. So we buy the best condoms and the best lubricants for them. So not only do they come and get ours, but they really know that they don't have to pay money to have really good material, and would encourage them to use it more. So that's something that they would get out of that specific workshop. And again, that's every last Wednesday of the month at 6 p.m.
Every last Wednesday. And the other workshops, how do they look?
Our calendar varies, so I would suggest that if anybody was interested, they would check us out on Facebook. And we have a Facebook URL. You can get a link to our Facebook page through our Calor page. Otherwise, if you were looking specifically for ACE, it would be facebook.com/ace@calor.com.
Okay, and you're also on Twitter, or?
Yeah, we are also on Twitter. Our ACE project's on Twitter. So if you like to tweet, we also have some sort of workshops that we do that's just based on Twitter in general, Twitter chats. So we're actively on Twitter, and we're at @ace_Calor on Twitter.
Awesome. So these workshops, and from what you're telling me, are incredibly empowering for these individuals. What have you had anybody go through these workshops and you know, they've left, or they just took what they needed, grew with it, and learned, and then they've returned and said, you know, this was part of a life-changing moment for me?
I would say I have several examples of that. One of them would be like, you know, when we do club outreach and we just let them give some condoms out in the clubs and let them know that we're here if they want any sort of, you know, if they want to come and check out the groups themselves. We've recruited many core group members that way. So part of this decision-making body, they've gone from, you know, just seeing us in the club to actually coming to our groups to actually saying, I'd like to be a leader here, and actually being a part of that decision-making body. And even still, like, we've had a really good retention with some of our youth. So we've even been able to give them opportunities in leadership that would lead to employment. So one of our M Group facilitators currently has been hired within our agency. So he was hired as a leadership member of core group into a full-time position in our agency. And I think that is possibly one of the best success stories, because, you know, there isn't anyone that will know this demographic better than a client that actually has firsthand experience working with the agency and is a part of the demographic.
Yeah, definitely. So you mentioned you go out into clubs. How else do you do your outreach? Certainly, that's an important place.
We offer mobile testing as well. So anytime you see a ACE, a youth out in a club with the ACE shirt, you could be sure that there's going to be the ACE van right outside. So we offer rapid HIV testing in our mobile unit as well. Some people have a stigma with actually going into agencies that are associated with HIV.
Right.
So we find that if we're able to work with our clients or bring it into a different type of environment, if they're willing to get tested under those circumstances, it's the most important thing to offer them those opportunities.
Okay. Sounds like you do just a great bunch of great work, and
Thank you.
I'm curious as to what, and I know it's fulfilling work, but tell me about a moment or a conversation you had with someone where you were just like, this is where I need to be. I know I'm making a difference here, and I need to continue doing this type of work.
Yeah, I think that a conversation I've had with one of my youth definitely reminded me of how important it is to be here for them. You know, it's more than what we do, and the way we contribute to society could always be more than just a job. So I know that, you know, when you're working with people and that's like what you do every day, it's not like a wall you're staring at.
Right.
Like, you know, I could see the work that I do in the youth that I serve. I know that I've become something that they depend on, and I feel like a specific example of that would be when I had a youth who was in a difficult circumstance come to me and just asked me if I was going to be at group that day, and I did, and like really just needed to talk to me one-on-one about the troubles he was facing in his life and how much pressure he felt at that very moment. So him confiding in me and really taking something from our conversation together as to give him some sort of beacon of hope made me realize that how important it is for me to show up every day and to be something that's consistent in their lives and be something that they can count on.
Certainly.
And most importantly, just feel comfortable, because most of them have parents, but they don't feel comfortable talking to them, or don't feel as though the kind of advice that they're getting would be not biased when it comes from their parents. So I think that, you know, most of this youth that we serve, although we're open to all men of color, a lot of the primarily is Latinos. And I think that what's really important to consider with Latino families is although, like, you know, we have done a lot of advances in our state to, you know, to help support the LGBT community, unfortunately, culturally, it's still not something that's very accepted. So it's nice to have, even if it's just a room with a TV and a couch for the guys to come to and be themselves and not worry if they're being too much of anything, you know.
It sounds like you're doing amazing work. I mean, I keep saying that, but it's really great to hear that from you, and for our audience to hear as well. Thank you for coming today.
Thank you.
We're out of time. We could have a conversation for an hour. Perspectivas Latinas is a community service of CAN TV. If your nonprofit would like to work with CAN TV, call 312-738-1400 and ask for nonprofit services. Tune into Perspectivas Latinas for local issues and concerns every Thursday at 8:30 p.m. on CAN TV 21. I'm Juan Carlos Hernandez. Thank you for joining us.